Now let's talk a little bit about radiation. Radiation is energy that's invisible. We can't see it, but it's there. Radiation machines like this one generate a beam of this invisible energy. If we could see it, it might look like this. The radiation beam will go right through some things. It'll go through cloth, through skin, through bones, and it does it without hurting. You can't see it and you can't feel it. What does the beam do? Well, it can be focused on the place inside you where the bad cells are and stop them from growing. Your whole body is made up of cells. Most of them are good, healthy cells. Your body is always making new cells. Cells are very, very tiny. And just to give you an idea of how small they are, there are almost 1 million cells just in one of your fingernails. The beam that comes out of the radiation machine gets aimed and adjusted very precisely so that it affects mostly just the cancer cells. The beam will also touch some of the healthy cells near where it's aimed, but healthy cells generally repair themselves pretty quickly after radiation. Radiation treatments are painless. The beam won't hurt. Before you start your radiation treatment, you and your family will meet with the doctor in charge of your treatment. The doctor will talk to you about your treatment plan, and you'll find out how many times you'll have treatments and how long they'll last. After that, it's time for you and your team to do some preparation work so that the radiation beam will be aimed just at the right place inside you. One of the most important jobs you'll have is to stay still while you're getting your treatments. Now, staying still is not always easy, but if you try, you can stay still for a pretty long time. And the more you do it, the easier it gets. One way to help you hold still for your treatments is to use an immobilization device. That's a fancy word for a mold or mask that helps you stay still while you're having your radiation treatments. They also help make sure the beam is aimed exactly where it needs to be. If your treatment area is your head or neck, you might need a mask. A mask is made out of this mesh material, and it's made just for you. Here's how. You'll lay down, and a therapist will soak the mesh in warm water and then put it over your face. It won't hurt. It'll just feel warm and wet. You'll be able to breathe through the holes in the mesh. The therapist will connect the mesh to a frame on each side of your head, and while it's still wet, gently make the mesh fit your face and head exactly. Then you wait for it to dry, about 10 minutes. Someone from your family can be in the room with you when your mask is being made. They can talk to you, but while your mask is drying, you'll need to keep quiet so your mouth doesn't move, and you'll need to keep your eyes closed. When your mask is dry, the therapist will remove it from your head, and you'll see that it keeps the shape of your face.
Is your mask, like, cut out the eye holes right here?
Sometimes holes might be cut for your eyes and mouth, but even without them, you can see and breathe through the mesh. We save your mask so that it's always here and ready for you when you come back for treatments. Here's another kind of immobilization device. This one's for your whole body, and it's called an alpha cradle. Your team will mix up some chemicals to make a liquid that looks like batter or paint, and then pour it into this big plastic bag and spread it around. You'll lay on top of the bag, and your team will make sure you're in just the right position.
Good job.
The chemical underneath the plastic will start to puff up around you, and it will feel a little bit warm. You just need to stay still while the chemical puffs up to fit the shape of your body. Someone from your family can be with you the whole time your mold is being made. After about 20 minutes, the mold is done puffing up and is dry and hard. You'll see that it holds the shape of you, so when you come back for treatments, you'll fit right into it. It will help you stay still, and it will help make sure the radiation beam is aimed just where it needs to be. Once you have your very own custom-made immobilization device, the next step is called simulation. It's like a practice session where you and your team get ready for your radiation treatments so that each time you have the treatment, the machine can be set up quickly and exactly. That's what simulation is all about. In the simulation room, there's a table that moves up and down, and an X-ray machine that moves all around the table. Your team will help you onto the table where you'll lie down, on your alpha cradle if you have one. If you have a mask, your team will put it on you. Your team might move the table up or down, and they'll move the X-ray machine to get it lined up just right. Someone from your family can be in the room while you get ready. Then they'll go to the waiting room while your team gets ready to take several X-rays. You can bring a toy or blanket with you if you want. The lights in the room will be dimmed so that your team will be able to see the lines and numbers that are projected on you. The lights that make the lines and numbers don't do anything except help your team put the X-ray machine in exactly the right place. Your team might make temporary marks on you with a magic marker. These marks will help them aim the beam later on when you have treatments. You'll need to lie still while your x-rays are taken. The therapists will be in the control room right next to the room you are in. They can see you and hear you the whole time. You'll hear the camera changing position and the therapist changing x-ray film between pictures. Your team develops the x-rays and then checks them. Once they're sure all the x-rays are okay, simulation will be all done. Depending on your treatment plan, your team may need a different kind of picture for your simulation. Instead of x-rays, you might need a CT scan, also called a CAT scan. This is another way of taking pictures of your insides. For CT scan pictures to show everything your team needs to see, you may need to drink a liquid called contrast, or you may need to get contrast through an IV. Getting an IV is something you may already be used to, or it might be the first time for you. It only takes a few seconds to get it started, and then it's just there. You might even forget about it after a while.
Very good.
For a CT scan, you lay on this table, either on your back or stomach, and the table moves through this part that looks like a donut hole. The machine takes pictures that will help show your team exactly where the radiation beam will need to be aimed for your treatment later on. The CT scan doesn't hurt, but it makes some funny noises. A member of your family can come into the room with you and help you get ready. Then they'll wait in the waiting room while the scans are being done. You can bring a soft toy or blanket with you if you want. And you can listen to music. Bring your own CD or tape, or listen to one of the ones we have. The therapists on your team will come into and go out of the room a few times. When they leave, they go into the control room right next door. They can see you and talk to you and hear you the whole time.
Doing a great job, Andrew. We're almost done.
When you're done with simulation, your team has all the information they need to set up the radiation machine that will be used for your treatment. There are two types of radiation treatments we give here at MGH, Photon and Proton, and they each use a different machine. Photon beam therapy uses a machine like this called a linear accelerator that looks very much like the X-ray machine in the simulation room. The other type of treatment is called proton beam therapy. It uses a different machine called a proton beam accelerator. What's the difference between photon and proton? Here's Dr. Nancy Tarbell, the Director of Pediatric Radiation Oncology at MGH.
Photon and proton therapy both basically do the same thing. They both aim a beam of energy at cells inside your body. The beams have different ways of putting the energy into your body, but they're both useful and effective ways to treat cancer. Your doctor takes into consideration information about your tumor, especially the tumor type and location, when planning the most effective treatment for you, which may be photon, proton, or a combination of the two.
The proton machine is huge. It's so big that only part of it is in the room where you'll have your treatment. Your treatment table moves into various positions. It puts the part of you to be treated into the middle of this large ring that looks like a curved wall and moves around in a circle. By adjusting the ring and adjusting the table you are on, your team can aim the proton beam from different directions. Before your first treatment, some of the people on your team make these special devices called an aperture and a bolus. They use the CT scans from your simulation to make them especially for you. They put them into the proton beam machine to help shape and control the beam just right for your treatment plan. A member of your family can come into the room with you and help you get ready. They'll wait in the waiting room during your treatment. You can bring a blanket or toy with you, and you can listen to music during your treatment. The proton beam machine also takes X-rays. Your team will first take an X-ray and then move you into the right position. Then the proton beam will be turned on. It doesn't hurt, and you won't feel anything. When the beam gets turned off, the therapist will move the ring so the beam comes from a different angle. Take another X-ray, adjust your position, and then turn the beam on again. You'll hear lots of noises during your treatment. The ring moving, the X-rays being taken, your team making adjustments to the machine, and, of course, your music. Your treatment team will be in the control room right next door and can see you the whole time. Since we want you to stay as still as possible, please don't talk during your treatment. If you're having a problem that you want your team to know about during your treatment, there's a handheld buzzer you can use to let them know. Each of your treatments might take about an hour, maybe less. Your doctor will tell you how many treatments you'll have. When you don't need to be at the treatment center, your time is your own, and you can go sightseeing or do whatever you feel up to. One important thing to know about the Proton machine is that it's very special. There are only a few of them in the whole world. Here's Dr. Tarbell again.
The Proton machine is a high-precision, complicated device. It requires lots of maintenance and calibration to run properly and safely. Once in a while, the proton beam may have unexpected downtime. In that case, we may have a plan of photon treatments for you. It is also helpful if your family's travel schedule can be flexible in case your treatment schedule needs to be adjusted.
Some of your treatments, or all of them, may be photon therapy treatments using the linear accelerator. Your therapists will put these things, called blocks, into the linear accelerator so that the radiation beam is shaped just right for you. When it's time for your first photon treatment, you'll get onto the table just like you did for simulation. A family member can help you get ready, then wait in the waiting room during your treatment. You can bring a blanket or a toy and play music if you want. Your team will first take a set of x-rays to line you up for the treatment. Treatments are usually shorter than simulation. Just like with simulation, you'll need to hold still.
Outside, you're going to hear a buzzing sound, okay?
During your treatment, the table and the machine may move to aim the radiation beam at your treatment area from different angles. The radiation won't hurt, and you won't feel anything, but the machine will make noises. After about 5 or 10 minutes, your first treatment will be done. You'll have treatments every day except for weekends and holidays. Your treatment is different from everybody else's. Your doctor or nurse will go over your treatment plan with you and your family and will tell you about any possible reactions and how they can be treated. If at any time during your treatment you have any questions at all, please ask the members of your treatment team. While you are here, you'll have weekly status check meetings with your doctor and nurse. When your treatment schedule is over, your doctor will go over important information with you and your family before you leave. Make sure to ask any questions you have. And that's about it. So to review, at MGH, there's a team of doctors, nurses, therapists, and social workers ready to work with you and your family to make your treatment plan the best it can be. The first part of your treatment involves planning and preparation. Your team will make the immobilization devices you'll need to help you hold still for your treatments. Someone from your family will be able to be with you most of the time, and close by when they can't be right in the room with you. You can bring your favorite blanket, toy, book, or music with you. There are some times when you'll need to stay still and quiet. Simulation will usually take longer than your actual treatments. Having x-rays taken, getting a CT scan, having photon or proton beam treatments, none of these hurt. If you're having proton beam therapy, you may need to be ready for schedule adjustments if there's machine downtime. If there's anything you don't understand or something you want to know or anything that's worrying you, just ask any member of your team. We like questions. I hope what I've told you and shown you helps you and your family get ready for your treatments here at MGH. If you have any questions right now, call or email us. The contact information will be on the screen in just a few seconds. For now, so long. See you soon.